Ohio's unemployment rate is currently around 5.4%, I believe, the last time I checked. And so employers are continuously looking to grow their teams. So aside from looking at your internal teams and how to develop them, what are some of the most important traits or even skill sets that you look for whenever you're hiring within your organization?
Yeah, sure. So very similar to my answer with leadership development, we're really intentional about the culture that we have, and we've defined that culture. And we've defined that culture by answering some pretty basic questions about who we are as an organization, such as why do we exist? How do we behave? And through answering questions like that, you start to create or intentionally define the culture that you have. So in answering that question, how do we behave? We define essentially those behaviors that we want to hold up and not necessarily aspire to, but enact. So for us, the answer to the question, how do we behave, is we serve humbly, we seek wisdom, and we build trust. Those are really important behaviors that we look for in our staff, and we try to promote those. So when we're hiring people, we're looking for people that, do they serve humbly? Do they seek wisdom? And can they build trust? And if they get through those sort of edits, if you will, the technical competencies in a lot of ways we can teach. That's not the hard part. We certainly would love people to come in the door who are experts with certain technical skills. I'm not diminishing that at all. But the primary focus is, are they a good cultural fit with us? And we evaluate that by looking for those characteristics or those behaviors. And if that's the case, then fabulous. I think we got a person who we can really work with.
Yeah, I think that's great. Well, and even kind of going back to what you had previously mentioned, in the healthcare industry. So, since the COVID-19 pandemic, it placed an enormous strain on the global healthcare sector, their workforce, their infrastructure, their supply chain, you name it. So what are some of your current goals as an organization, and what are you looking into? I know you previously mentioned you're doing a lot towards your digital transformation. So can you elaborate on that?
Yeah, sure. I think I'll sort of answer that question maybe in two parts. The first one is sort of Kettering Health as a whole. We have been very successful over the past, 7, 8, 9 years or so in terms of growing our market share and increasing our footprint across the region. And growth continues to be it continues to be an important strategy that we pursue organizationally. And in order to do that, the IS teams that I'm really fortunate to get to oversee are part and parcel to that growth. So when we build new hospitals, when we build freestanding ERs, when we buy physician practices and incorporate them into Kettering Health, all of those activities that fuel growth are in many ways founded on the information technology and the services that my team provides. And so from that standpoint, we are part and parcel to Kettering Health, the overall success and growth of Kettering Health. I think the other part of the question, or the other answer to the question then is, for my organization, what are we trying to do? And we certainly are trying to drive digital transformation. There's no question about that. I mentioned I have responsibility for the access strategy, and a really significant element of that is the digital transformation and the digital tools that we're putting in the hands of what we refer to as our guests, which is not just the patients, but also the care team around the patients. So you think about it, rarely does anyone walk into the hospital by themselves, right? It's their wife or their husband or their son or their daughter or their father or mother is with them. So when we say guest, we certainly include the patient, but we also include the people who are supporting them. So what kind of digital tools can we put in their hands to make sure that their experience in receiving care from Kettering Health is as good as it can be? And that's been a huge focus for us over the past couple of years, and certainly will continue to be.
Yeah, I think that's wonderful. That's all the questions that I have today. Really appreciate you elaborating on everything. It was such a pleasure to have you here today and to provide some great insights. So thank you, Andy.
Thanks, Catherine. I appreciate you taking the time to talk with me. That's for sure.
Yeah, you're welcome. And for more one-on-one interviews, please visit comsparkmagazine.tech for additional interviews.